Ken Landau. Thanks for watching. Let's talk about Lamictal or Lamotrigine. This is a drug first approved by the Food and Drug Administration in 1994 for partial seizures or generalized seizures, that's epilepsy, first in adults, later on in children, sometimes by itself, sometimes in combination with other anti-convulsants. And then in 2003, the FDA said, well, it's probably okay to use the drug also in bipolar disorder, not for treating the acute depression, not for treating the acute mania, but maintaining stability in between flares of the disease. Seems to be better at preventing the depression than it is in preventing the mania. But it comes with a black box warning. And the black box warning suggests that there's an increased incidence of a life-threatening skin reaction called either Stevens-Johnson syndrome or toxic epidermal necrolysis, or the DRESS syndrome, D-R-E-S-S. It stands for drug reaction with eosinophilia and systemic symptoms. Nearly all cases occur in the first 2 months of taking the drug, or if a person stops taking the drug and then suddenly restarts it at the same dose that they were taking. There's a problem because rashes are very common with this particular pill. And it seems that somewhere between 5 and 10% of people may develop a rash, but that rash is the typical drug rash. Unfortunately, you can't tell early on which rash it is. Now, statistically, it's going to be the benign rash, but you don't know that. It's a more common rash in children than in adults, so we like to limit the treatment as much as we can to adults. It also is important to realize that if you happen to take Valproate, if you take Valproate and Lamictal at the same time, the concentration of both of those drugs are going to be increased in the bloodstream, and it's going to have a predisposition to develop the rash. Well, the rash can start off sometimes with fever or fatigue or aseptic meningitis, and then the rash, it's potentially very serious, as I mentioned, can lead to acute multi-organ failure, can be fatal, more common in epilepsy, hardly ever in bipolar disorder, if ever in bipolar disorder. The rash, as I said, is more common in children than it is in adults, and most of the time the rash is benign. Now, some other side effects that you can have with this medicine include sleepiness or drowsiness or headache or trouble concentrating and trouble with coordination. You have memory changes, mood changes, loss of balance, you have double vision or cross-eyed, or maybe sometimes the pupils are constricted. You can have blurred vision. Other common side effects include headache and tremor and dry mouth or nausea, vomiting, diarrhea. Some people develop abdominal pain or fever. Some people with some dizziness or anxiety or vivid dreams or weight loss. And about 7% of the people are going to develop an incapacitating and intolerable type of insomnia. It's an alerting effect that comes with the drug. On the other hand, some people seems to improve the sleep stability and increase the REM duration. Well, in 2010, the FDA added a warning and said it can cause aseptic meningitis, and they also said it can cause certain types of white blood cells to gobble up the red blood cells, something that we call hemophagic lymphohistiocytosis. A rare condition, but something that we know about. It also can cause certain blood dyscrasias. It can cause some suicidal behavior and thoughts that people have. Seems that it's a common side effect of most anti-epileptic drugs, increases the risk compared to a placebo of about 2-fold, but again, it's pretty rare. Even though the drug is an anti-seizure medicine, it may induce seizures, especially juvenile myoclonic seizures. So if you're taking the drug and anything happens that's out of the ordinary, you ought to call the doctor. Now, side effects with Lamictal seem to be more common in women than they are in men, which is opposite to most anti-convulsants that have side effects more common in men than in women. Interestingly, if people are taking the birth control pill, there's a potential problem because the estrogen decreases the concentration of the bloodstream about 2-fold. Okay? It reduces it by about half. On the other hand, when you're taking the birth control pill, most women have 1 week per month when there isn't any hormone in the pill. And in that week, the concentration of the Lamictal in the bloodstream increases by a concentration of twofold. And during that week, a person could have some dizziness or ataxia or double vision. So you have to warn the doctor if you're taking the birth control pill, and certainly if you stop taking the birth control pill, your dose of Lamictal needs to be adjusted. Now, it comes in a variety of different strengths, 25s and 50s and 100s, 150s and 200s, both as tablets and oral disintegrating tablets that you put in your mouth and you suck and let dissolve. Comes in starter packs of 25 milligrams and some 100 milligrams, or you can get the standard dose that I just mentioned. Whether you should take the drug in pregnancy is always a concern. There are some minor malformations that have developed, cleft palate among them. The drug seems to be a weak inhibitor of an enzyme that's very important in folic acid metabolism called dihydrofolic reductase. And unfortunately, drugs in that family, also methotrexate in that family, can be teratogens, cause some sort of birth defect. It interferes with the production of nucleic acids and with proteins, so not a good idea, nor should it be taken while a woman is breastfeeding. The way it works is it increases the activity of gamma-aminobenzoic acid, GABA, which is an inhibitory neurotransmitter in the central nervous system. So it works on the sodium channels and the calcium channels. It works to suppress the release of glutamate and aspartate. It seems to prevent the spread of seizures. That's how it works in the seizure part. How it works in the bipolar part, haven't the slightest idea, unfortunately. Seems not to have an effect on serotonin or dopamine or norepinephrine. Doesn't have any effect on the NMDA, some other chemicals in the brain. Well, when you take the drug, it's going to be absorbed. It's going to be absorbed pretty rapidly. The peak concentration in the bloodstream is going to be about an hour and a half to 2 hours, but it might be lengthened up to about 5 hours. Doesn't change whether you eat or whether you don't eat. The bioavailability is going to be almost 100%. The half-life of the drug is about a day, 29 hours. But if you take the Valproate with it, it's 2 or 3 days. About half of it is bound to plasma proteins. It's inactivated in the urine, and it's excreted almost 95% in the urine. It has fewer interactions than some of the anti-convulsants, but it does certainly have significant interaction with other anti-epileptic medicines. So if you happen to be taking Dilantin or phenobarbital, or if you happen to take primidone, or if you're taking some of the other drugs, or even if you're taking rifampin or estrogen, it's going to decrease the concentration of the Lamictal by about 40% or thereabout. Doesn't seem to have any effect on lithium, but you do have to be careful of Valproate. If you take Valproate, the concentration of both the Valproate and the Lamictal goes up. While you're taking the drug, you need to have your kidney function and your liver function periodically monitored. When you take the drug, you start off at a slow dose and you gradually increase it. You don't do it too fast, and you don't take too much of the drug to start. Otherwise, you may well end up with the rash. So it comes as a starter kit of low dose, so you can take it slowly. You don't crush the pills, you don't chew the pills, you don't break the pills, you swallow them whole. But they do make an oral disintegrating tablet that you just put on your tongue and let dissolve. So let's say you have bipolar disorder. Well, the target dose is going to be 200 milligrams a day. But if you're taking Valproate, the target dose is 100 milligrams a day. But if you're taking Tegretol or Dilantin or Primidone, or you're taking phenobarbital, the target dose is 400 milligrams a day. So let's say you have bipolar disorder and you're going to start the Lamictal. What you do is you take 25 milligrams once a day for the first 2 weeks. The second 2 weeks, you take 50 milligrams a day. The fifth week, you take 100 milligrams, and then you're at your target dose on the sixth week. On the other hand, if you're taking Tegretol or Dilantin or phenobarbital, you increase quite considerably. You end up with 400 milligrams. So on week 6, instead of 200 milligrams, you take 300 milligrams. On week 7, you're up to 400 milligrams. But if you're on Valproate, for the first 2 weeks, you take 25 milligrams every other day, and that's followed week 3 and 4 by 25 milligrams a day. Week 5, 50 milligrams a day, and you're at targets 100 milligrams a day on week 6. Now, as I mentioned, it comes in starter packs that combine mostly the 25 milligram pills and some of the 100 milligram pills. You have to be careful if you decide you're going to stop taking the drug. You don't do it too quickly, too abruptly, because otherwise you may well increase the likelihood of having seizures, even if you never had seizures before, if you're taking it for the bipolar disorder. So it's a good idea sometimes to wear a MediAlert bracelet. Now, people who are taking the drug for epilepsy are going to discontinue it because of side effects in about 11%. So 1 in 9 people who take the drug are going to stop. Bipolar disorder, it's going to be 1 in 6, or about 16%. You could overdose on the medicine if you take too much and get some ataxia, difficulty walking, or some nystagmus with your eyes going back and forth, decreased level of consciousness, or uncontrolled seizures, or cardiac arrhythmias, or coma. Or ultimately, some people die because of taking the drug. And interestingly, the drug seems to bind to tissues that contain melanin, like the iris in the eye. We don't know that it has any long-term consequences, but it's suggested that if you take Lamictal, you ought to see the eye doctor every once in a while. Even if you take just one pill one time, the medicine is going to be present in your uveal tract for up to a year. And if you happen to take the drug, it could interfere with some of the lab screening of the urine. Now, it's important to realize that most of the anti-epileptic drugs seem to work about the same. So your choice of an anti-epileptic drug should be based on tolerability. Lamictal, it's a first choice for people who have partial or focal epilepsy. It's relatively well tolerated. There's relatively little sedation or cognitive impairment. Doesn't seem to make your weight go up. Seems that it's less effective compared to Valproate if you happen to have generalized epilepsy or tonic-clonic epilepsy, the kind with the shakes. If we're talking about bipolar disorder, well, if you have mania, the standard treatment would either be Tegretol or Valproate, or best choice perhaps would be lithium. If you take the Lamictal, remember, it doesn't change the depressive episodes, it doesn't change, it's not a treatment for the manic episodes. It's a drug that helps prevent the recurrence of those symptoms. And it seems that there are 2 types of bipolar disorder. Type 1, that's where a person has the more severe mania, and type 2, where the person has what we call hypomania, less severe mania. It seems that Lamictal works better when a person has the less severe type. Now, several studies have shown that it's not good for the treatment of depression, but remember, it's good for the maintenance. So when a person has bipolar disorder, we used to call it manic depressive disorder, and most of the manifestations are depression, hey, this is a good drug. It's not recommended for treatment of any psychiatric disease. It's often used off-label for a variety of disorders without good proof that it works. So it's used for peripheral neuropathy or trigeminal neuralgia. It's used for migraine, or it's used for a cluster headache or neuropathic pain, or treatment-resistant obsessive-compulsive disorder, or depersonalization disorder, post-traumatic stress, borderline personality disorder, schizoaffective disorder. Well, in classic studies of epilepsy, it seems, as I mentioned, that all drugs seem to work okay, but oftentimes a person needs a combination of therapies. The first drug might not control the epilepsy, so then you might add another drug. Well, is there any benefit of taking drugs versus the old drugs like Tegretol or Valproate or Dilantin, the newer drugs maybe like Lamictal or Keppra? No, it all depends on how well they're tolerated. They all seem to work about the same. Now, there is a failure to control the epilepsy in a certain percentage of the people. People who seem to have a lot of seizures before you begin therapy, people who have a longer duration of their epilepsy, people who have taken recreational drugs or have a family history of epilepsy or family history or personal history of psychiatric disorder, history of febrile seizures, those people have more difficult to control seizures. The first treatment generally works in about 50% of the cases. Second treatment, add-on treatment oftentimes, an additional 12% have improved control. Third drug adds only about 4% extra, and then each additional drug only adds 1 or 2%. Now, there are multiple generic brands of Lamictal available, and there's sometimes a quality control problem. So if you are taking the generic, it's a good idea to take the same brand all the time. When you change brand, there might be a problem. So there was recently a case where the Teva brand didn't seem to work very well. Well, if we're talking about studies controlling bipolar disorder, there was an interesting study that looked at Seroquel and Lamictal together, or just Seroquel, and those people were given either folic acid or they weren't given folic acid. Now, a lot of people are taking folic acid. A lot of people like to take vitamins and supplements. So what happens when you take some of these supplements? Well, interestingly, remember I said it interfered with the mechanism of folic acid metabolism, the dihydrofolic acid reductase enzyme? Well, it seems that if you take the Seroquel and the Lamictal, it's going to be much better to control your bipolar disorder than if you just take the Seroquel. But if you take the combination with folic acid, it erases any benefit. So it's important that you discuss in depth any kind of supplement that you happen to take when you see your doctor. How much does all of this cost? Well, Lamictal is very inexpensive. You can buy 30 of the 100 milligram tablets for cash less than $30, unless you go to Walgreens or CVS where it's around $80. If you have a coupon, most stores will sell it to you for $3 to $13. But again, if you go to CVS or Walgreens, it's going to be considerably more, but not nearly as much as if you get the brand name. If you pay cash for the brand name, it's going to cost you almost $690. If you have a coupon, it's going to cost you $550. That's why chances are you're going to take a generic brand. So there you have it. We have Lamictal. It's a good drug, but it's not a great drug for epilepsy. It can interfere with a variety of other drugs as far as the metabolism is concerned, so you do have to be a little bit careful. We have the problem with the rash, and it doesn't treat either the depression or the mania of bipolar disorder, but it can help extend the time between the episodes. If you have any questions about some of these other drugs, well, you can watch my videos about them. Anyway, thanks for watching. I'm Dr. Ken Landau.